know it was going to be.
Hi, Marion. Lovely to invite you onto Integrative Medicine Matters podcast. Excited to get a deep dive into all things nature connection and social prescribing. But we always start with this question, why does integrative medicine matter to you?
Hello, Elizabeth. Lovely. Thank you for inviting me to talk this morning. It's a beautiful sunny morning, and I'm looking out onto some wonderful autumn colours, which I hope are going to inspire our discussion. Why does integrative medicine matter to me? I think that medicine without the integration would be a very pale and unsatisfactory phenomenon without the meaning and texture and wholesomeness that I feel that integrative medicine brings. Very early on in my career, I realized that allopathic traditional medicine didn't hold all of the answers, and in fact created quite a few problems of its own. And so started to notice things that could be drawn in to make sense of some of what happens around people's lives that very much influences their health. And so as my career has progressed, I've gathered tools along the way and incorporated them into my consultations, into my practice. And that's been very enriching for me and brought more meaning to the medicine that I practice. And I think it has enriched the experience of the patients too. And it's felt much more of a journey with patients doing that. So I find it difficult. I'm sure this is the same for you when you're really absorbed by something. You find it difficult to remember that other people are not thinking in this way. And I find it hard to believe that there are people still who feel that a narrow approach to health is appropriate or effective or the right way.
Yes, I remember. Yeah, I remember teaching with the whole person care, and one of the medical students' feedback on a post-it note was, you know, if I wanted to look at these issues, I'd have trained as a social worker. And it was such a clash of ideology because I felt that that broadening out of medicine was so important. So, Marion, you're a busy GP in Bristol, but you have also this interest in nature connection. Where did that all begin?
Well, I'm not quite sure. I think I first noticed nature connection when I noticed the absence of nature connection or the opportunity to connect with nature. And I think it was when I was a student in London and living in a council flat in Bermondsey and looking out onto concrete. And I think there was a sort of deep unhappiness, which was unspoken at that time. But I noticed I was much happier when I went home and wandered around the riverbanks in Durham where I grew up. And since then, I think I have put nature into my life in order to enrich it, in order to be grounded, in order to be my best person, really. So I think that's when it started.
Yeah, so a long, long time ago, and that kind of personal need, you kind of held your heart there.
Mm.
Listeners won't have seen that, but where something really mattered, and I too was at in London in one of those estates, and just like it's very hard when you're surrounded by concrete, and now I'm surrounded by trees, which I love and appreciate. Tell us a little bit about your role as chair of this kind of alliance of nature connection organizations, because that kind of reflects this growth at the moment of interest and how connecting people to nature might enhance their health and well-being and their mental health.
Indeed. Well, we're very lucky in the West of England. I think we do have a unique model which involves the West of England Nature Partnership, which is a collaboration of organisations working for nature recovery across the West of England. So these are quite a variety of organisations that you wouldn't necessarily think of in connection with each other or in connection with health. So we've got local councils, wildlife trusts, river trusts, the Wessex Water, the Farmers Union, Natural England, the National Trust, all organisations that have an interest in land and in nature. And within that, we have the Nature and Health Steering Group, which is as you say, a group of people and from different organizations who are working in themselves, but also together to bring nature more into the lives of people for the benefit of their health. And within that, we have a strategy which I think is useful to explain. So it's actually concentric circles within each other. The outer layer is planetary health, and we incorporated this because we need to acknowledge that without planetary health, we have no human health. Then the next layer is the experience of nature in everyday life. So the way that people can access nature just by stepping outside of their front door and perhaps walking to the bus stop, and what they see on the way there that might promote nature connection. Then nature in health promotion, the way that we can encourage people to do activities outdoors, which will bring them health. And then at the center is nature actually as therapy, nature as medicine, where it can be used as part of a pathway for treatment alongside other treatments as part of integrative medicine. And so within this strategy group, we look at all of those. We have focused most closely on the inner two layers in the last few years, because we had the opportunity in 2021 to take part in a national pilot of green social prescribing. So social prescribing, in case there are people listening who aren't familiar with that term, is the use of non-medical resources to support health. And this is a lot to do with reducing loneliness, with people being able to access things very close to them in their own community, to build bridges and alliances, and to participate in activities which might range from art groups, walking, cooking, but also the green social prescribing offer is to do with doing things in nature. And again, there's a very broad range, ranging perhaps from walking to forest bathing, making use of the wonderful benefit of trees, which is very well proven now. And then for all age groups and all abilities. And the Green Social Prescribing project that we took part in, which was funded, was acknowledging the fact that we have now a large body of evidence which shows the benefits of nature for health. And we weren't trying to prove that, but we were trying to reach people specifically who were at high levels of need, particularly post-COVID, of mental health problems, and also were perhaps not familiar with nature as a tool in their lives. So those were the aims of the project.
And may I ask about the evidence base? Because I was at the British Society of Lifestyle Medicine conference, and there was one doctor kind of poo-pooing the evidence for social prescribing. But my understanding is that body of evidence has been building, although it's also varied across so many different projects. So I wondered if there were some key elements of evidence that you could share with us.
Yeah, well, there's the evidence for social prescribing as a service, and then there's the evidence for nature as a health intervention, so to speak. I think some of the problem is that there have been many studies, and one of the early studies, which led, in fact, in part to the NHS introducing social prescribing as a statutory service, was one in Rotherham, and it showed return on investment across a number of areas, not only health. And I think this is difficult. This is where, again, the integrative approach is so helpful. You're thinking about that individual, but you're thinking about that individual within a family, within a community, within society. And the returns on investment are not only in health and in reducing the number of visits, for example, to the doctor or to using primary care services, and possibly also a reduction in prescribing, although it's much more difficult to unpick that data, but also a reduction in the cost of work and pensions, because people get jobs instead of being on benefits, and in the criminal justice system, because people are not offending so much, and in the education system. So when we're not good at working together, we're still working in silos, especially where when funding is tight. And so to encourage people to have a shared investment fund, I think, is the way forward. And certainly in terms of green social prescribing, this is the aim. The pilot funding is now ended, but there are a large alliance of organisations who are seeking to have a shared investment fund that could carry it forward. In terms of green social prescribing, I would point that cynical individual towards the evidence-based gathered together by Natural England. Natural England are a national body in the UK, rather like the National Trust, and they have they've got a whole series of data and analyses across different conditions around nature interventions, and I think that's where she should take her reading if she'd like to read the evidence. It's not as easy to prove as if you've got a Western medical trained mind. If you're looking for meta-analysis and randomized double-blinded controlled trials, then it's not so easy to set those up in these interventions. In terms of the data that you get out, it's in a way more meaningful because you're dealing with real people.
Yeah. And you also bring to light this idea of complexity, that, levels of complexity are growing all the time if we start to see the individual embedded in their family, community, right up to planetary health. But we also can't ignore that complexity. That is the complexity that people are living in. I did want to mention what would be very hard to do, a randomized placebo-controlled trial, is some of the work you've done with cold water swimming, which you're a great advocate of. But I know that some of that work that you've done in Henley's Lake, people really appreciated being able to, to swim in this beautiful lake. Can you tell the listener a little bit more about that project?
Yeah, this started quite a long time actually before the Green Social Prescribing Project, and it was a very simple idea, and like all good ideas, it was very easy to do it and very successful from the start. And it is on an ongoing basis being evaluated, but with very simple parameters. So it's just looking at the Office for National Statistics ratings for happiness and anxiety. And those are the same parameters that were used for evaluation in the National Green Social Prescribing Project. And people were referred from their practices, general practice, either the doctors or other people in the practice would refer them. And they would join a group that would walk from the Greenway Centre, the local community centre, through some beautiful woods to Henley's Lake, and then they would gather together in a circle and sit on the lawns and would swim if they wished. And I must say, when I suggested it, I did think that people might need some assistance to get into the cold water because it's a deep lake with opaque water, and I wasn't sure people would have the confidence. And it's cold. I didn't mention that. It's cold all year round. And I was amazed that at least half the group just decided to get in the lake straight away. Some beautiful outcomes, and people who spoke very powerfully about how this just was such a reset in their lives. People who'd had very complicated lives, many layers of trauma, often with substance abuse, and some of the conditions that we know are associated with difficult lives, fibromyalgia, depression. And for some people, this was the thing that really was getting them back on track. And that, I think in that setting, the cold water in itself has a therapeutic effect, but the beautiful setting around trees and lawns and birds and ducks, I think it also has a powerful effect. In fact, the cold water swimming now, you're right that there hasn't been a lot of research, although there has been some quite extreme research. So the military have invested in a bit of research, and NASA has done a lot of research on the effects of cold water. So we know what it does physiologically, and we will know soon with more granular data, what it does psychologically and to the whole person, because there is a study coming soon from Dr. Heather Massey, who is herself a fantastic cold water swimming down in the south, on the south coast, and her unit have done a randomized control trial, or at least it's controlled. I'm not sure about the randomization, but that data is coming out soon. So I'm really looking forward to that. We also have, I must tell you about this other project, because alongside the Henleys Lake swimming, a bit later along the line came Open Minds Active, which is a fantastic organisation, a community interest organisation locally, who, as part of their work, draw groups of women from a variety of non-white backgrounds in part of Bristol, where there are lots of different communities from different diaspora represented. And they offered these women cold water swimming outside, and they said yes. And then they discovered actually a lot of them couldn't swim. So they take them off to Hengrove swimming pool and teach them to swim. And I think they've taught 500 women to swim on this project. And then they bring them into cold water settings, and they provide wetsuits so that their modesty is preserved. And they're from all sorts of different backgrounds and often have very complicated lives, often refugees, and are suffering from depression, fibromyalgia, social isolation, and sometimes have significant caring burdens, children with learning difficulties, autism, older parents that they're looking after. And they are on medications, pain medications, antidepressants, and the outcomes from them have been wonderful. And there are a series of YouTube videos showing individual stories, which are so impressive. They have benefited from a Sudanese swimming champion who happens to be a refugee in the east of Bristol, who joined the tutors, and recruiting people from the local community to these projects is a common thread of success. So finding out what the local community want, recruiting local people who are interested and embedded and can talk to their friends and family about what they're doing and recruit them and give them confidence, because often they're stepping outside their comfort zones, not only into water, but sometimes people aren't even used to going into their local park for a walk. So these are all barriers which are broken down quite naturally by just introducing people and making it normal.
Yeah, fabulous. Fabulous to hear those initiatives. And it does link, doesn't it, with this 10-year plan that the NHS has developed around neighbourhood and how we build these connections and how we can support people's health and well-being.
Absolutely.
Yeah.
And I'd like to give a bit of a shout out to these community organisations which have been beavering away through the ups and downs of economic recessions and other challenges, and are really strong with some really amazing people, quite diverse organisations. And I think it would be great if every general practice was linked with their local community organisation, so there could be mutual benefit in that. Then the staff in the practice are familiar with what other non-medical resources are available, even without a social prescription, what people can be doing, where people can be signposted to. And the neighbourhood organisations can understand the pressures and the needs of the patients and develop services hand in hand with the practices.
And there are social prescribing link workers in every practice and more health coaches. Is that something that you're enjoying watching develop?
Yes, this really strengthens the integrative approach, having people within the organisation that you can hand over to, because there's no doubt that it's difficult to get everything into even a 15-minute consultation, which we have in our practice, but not every practice has got 15 minutes. Some doctors are still working with 10-minute consultations, which is an impossibly short length of time. So to have people in the team who have more time, can accrue the knowledge, up-to-date knowledge, so that they know when they're recommending something that it is a service that's still running, that they've given the right phone number, or that they can even do a bit of what we call a warm transfer in social prescribing, which means they can go along with that person to the first session that they're going to attend of a walking group or a a chat session or an art group running locally to give them confidence. A lot of our most needy patients are just about able to get to the practice, but don't have much confidence stepping outside their front door in other spaces, and certainly not to meet strangers. So it's not a quick, social prescribing is not a sort of quick fix. Let's just shunt these patients off somewhere else. It does require attention to detail, and it requires time, and it's not fast, but it's incredibly worthwhile once you have really established a new support network for someone and they have found new strengths within themselves, they've made new friends. That is really going to set them on a different path of well-being.
Yes, and that network, it's a network of people, but then the people connect into nature. And then, of course, nature, we know that, being in green spaces drops your cortisol, drops stress. It feels to me like a beautiful mycelium of human and nature connection.
One of the lovely things that was taken forward by our local organisation, which is the Lockleaze Neighbourhood Trust in the north of Bristol. They had an initiative called Really Wild Lockleaze, and this involved asking people who live often in sort of cul-de-sacs or small streets which have grass verges, but often getting parked on and ignored, or litter strewn on them, and asking them whether they would like to plant a wildflower meadow, mini meadow on that space. So it would involve asking all the neighbours to talk to each other and to say whether they would like to do this, whether they're happy to give up that parking space. So that immediately introduces people to each other, and then facilitate them creating the green space with the knowledge and the tools, literally the tools, to dig up the grass and plant a wildflower meadow. They got a bit of funding from the bee pollinator fund of the West of England Combined Authority, and they got an award for their work because they've planted about, I think there might have been as many as 50 of these spaces within quite a small radius. So I think the bees of Lockleaze are extremely happy, and people have really been enriched by that. And they've developed a love of that green space. No one's throwing litter there anymore. There's also a community allotment which is completely open. Anyone can come. There are no gates, there are no locks, and the produce is shared. And again, I think when you join people in this way, it develops a new level of trust in the community. And we're not saying there are no problems in that community, but when the problems well up, they're much better placed to face them together, and the trauma is much less.
Yes, and it's so important, isn't it? And quite hard to capture how it's helping. I wanted to ask, because we get this question a lot when we're meeting potential new doctors who might join our master's program, of how do you put integrative medicine into practice? You've mentioned your 15-minute appointment, but I just wanted to get a better feel of how you would connect people into nature connection in a busy 15-minute appointment. Just talk to us a bit about that.
Well, I think it starts in the waiting room. So I think creating a little bit of a nature feel in the practice can happen, which is great for staff. And this is another thing about green social prescribing and introducing nature. It has benefits for staff, partly through just their exposure to nature, but also I think having another tool which is not medical and is refreshing. So I would go into the waiting room, and we do have some videos from the Wildlife Trust on the screen running in the waiting room. Some practices are playing bird songs in the waiting room. I play bird song in my consulting room. There are some wonderful YouTube videos with bluebell forests and bird song that you can have running in the background. And if you've got dual screens in your waiting room, you can do that. So I greet the patient. We've also got some promotional videos from the Lockleaze Neighbourhood Trust around this Really Wild Lockleaze initiative. And then I take them into the consulting room, and there are plants there, which I think give a kind of a feel of the outdoors brought indoors. And then I guess it would be a normal kind of consultation, but then in terms of health promotion, which I think would, for most doctors, come into most consultations, and certainly would do in mine. I would, if it was a consultation around mental health, I would use a question such as, I'm wondering if you have a connection with nature, or how does it make you feel when you go outdoors, and see a tree? Is that something that you've explored? And sometimes people have had that in the past, but have lost it. And often people are a little agoraphobic with their mental health problems, and you can see them thinking about it. Their eye movements suggest that they are thinking and perhaps conjuring up a visualization of nature at that moment. And you can use that, and discuss with them going outdoors, and particularly for people who are not sleeping well. And knowing your local green spaces is useful. So I have a little map on the wall, which was produced during our Green Social Prescribing project, which shows the local green spaces, so I can talk to the patients about that. We have a particularly beautiful park with wonderful trees. And so I would tend to talk about the season that we're in. And so now I would talk about the wonderful changes of colour in the trees and how people might use that. Then if they say, well, I can't go to the park, I just can't, I can't muster myself at the moment, I might talk about what is possible for them. So where do they live? What do they have? A garden? Do they have a window? Do they have a windowsill? Could they have house plants? These if they do feel, if there's something to hold on to there, then coming alongside someone in their lives, what is there that they might be able to connect with again, or connect with for the first time. If they can't go outside at all, then there are things like listening to bird song or watching videos, and doing visualizations of nature, perhaps as part of a meditation. And there are some great tools that I would signpost them to, and follow this up by sending them a text with these resources as links for their phone. So those are some of the ways that I would.
Amazing to hear that. It's like a wonderful little mini masterclass on all the ways, and also that kind of fabric of the general practice and bringing nature in. And I know that you've also been a great advocate of poetry as well. These ways as humans that we are moved by nature, by poetry. And as you say, there are many things disconnecting us at the moment, aren't there? That challenging our human spirit.
I think that what I've always worked as a GP in communities who have less, where there are challenges, socioeconomic challenges. And I think the wonderful thing about nature connection is it's free to all of us. We don't have to pay for it. It is around. Once you have that tool, it's something that you can use. And I would so wish that we could really, really give that to all children, because I know schools are doing their best, but we need to reinforce that. And forest schools are such a wonderful phenomenon, because they are facing challenges, even if they're not even if they're from homes that are stable and happy without many of the challenges that children do face. What's out there in the world is challenging. I think if we can give them tools to bring them back into a stable place, to bring them peace and understand how to access that grounding, that connection with what's out there, it's such a gift. I mean, it's like a silver spoon of a different sort if you can give that to children.
Yeah, beautiful. So we're coming up to the end of our conversation. So you're touching on it now, but I wanted you to talk a bit more about the future, how you see the developments. There is funding coming in, isn't there, that you're part of kind of creating wise counsel about how that might be used. Just talk to us a little bit about that kind of vision, that evolving vision.
Yeah, well, I think, as I've mentioned, I think every general practice, first of all, I'd like every general practice to have a garden. And I've been part of an initiative to have some pioneer practices who are interested in doing this. And we've had, again, a bit of funding from the West of England Combined Authority to create spaces which are beneficial for nature, so increase biodiversity, but also can be accessed by patients and staff. And I go back to my practice where I worked for 26 years. Every Thursday afternoon, I'll be doing it this afternoon, to grow vegetables and to encourage wildlife there, and offer that to patients and volunteers and staff. And I'd love that for every practice. So that would be part of a future vision. And then again, as I've already mentioned, linking to neighbourhood community organisations for mutual benefit. And then more specifically, I think we're trialling running nature connection courses for patients, particularly those with low-level mental health problems, which actually probably covers most people, but probably the more needy end of the spectrum where people are it's linked with physical problems, and perhaps people who are accessing services a lot in primary care. And this course has been developed by Froome Medical Practice, and we're going to be doing the same course using their very well developed nuanced toolkit in 3 other places in the UK, and evaluating that and seeing if it is possible to roll that out. So that would become an offer that the social prescribing link workers in the organisations can offer the patients. And then the hope is that once they've done that within a practice setting or held within the practice setting, but accessing nature, that they feel confident to go and join other community initiatives in nature. And there's a growing number of people who are really doing wonderful things which are helping that outer layer of our model, the planetary health layer. So they're really showing reciprocal behaviours which are positive for nature. And this is the wonderful thing about it. It really is a win-win situation. It's free to us, the benefits are free to us, but then engenders a wish to protect nature. So there are a lot of citizen scientists who are collecting data which is helping to clean up rivers and other nature spaces, and people who are campaigning to restore nature, which is so depleted in this country. So it's a very nice thing to be part of. I mean, I feel it has immense benefits to my own well-being. You know, there's no doubt about that. I'm doing things which I enjoy and which I know other people are enjoying, and is benefiting them.
And I like to be reminded about how important the integrative medicine model is around planetary health, because, you know, we know that pharmaceuticals have a very big carbon footprint. So if you are supporting health and well-being and health promotion and disease prevention with nature connection, it's a win-win, because we're, as you say, we're looking after ourselves more naturally. We're looking after nature and not we have a tendency to plunder, whereas this feels a lot more gentle and restorative.
Absolutely. It's also within the context of greener practices. So our practice and others across the country are looking to reduce their prescribing carbon costs. We know that prescribing is 25% of the NHS carbon costs, and that these approaches and integrative medicine very much would reduce that. And within the Integrative Care Board, the setting within which we practice, the secondary care is also very interested in this, and it sits within the Green Plan of secondary care that I also sit on that board. And our local hospital, for example, has got an allotment and has a number of green spaces, and has a green spaces ranger who will take staff and patients on walks. So it's becoming much more mainstream, and the mental health trusts have really, especially since the Green Social Prescribing initiative, are training all of their staff in nature-based approaches, and all of the locality mental health teams across the Avon and Wiltshire Mental Health Partnership have allotments.
Wonderful.
Uh,
Amazing. So it really, even in the time that I've watched you be very involved, it's just happening more and more and more. And yeah, it's wonderful to hear that kind of join up that might be possible, and crucially reducing isolation, which we now know is more dangerous than a lot of things we might do. So for those of you listeners who don't know, Froome Medical Practices has been very big in developing neighbourhood and showing reduction in admissions to hospitals. So all of these become really important elements.
Yeah, and indeed, reducing hospital admissions and reducing the length of stay in hospital, and reducing prescribing. These are also monetary costs. So although monetary costs aren't the only thing, that will help to fund it. And alongside that, reducing carbon costs. So as you said, win.
Lovely. Well, we have to finish, but thank you so much, and amazing. You know, I know what a wonderful GP you are. You're doing all the other important things, but you somehow manage to weave these things in, partly because of, yeah, as you say, it's richer, it's more interesting to do medicine in this way. So thank you so much, Marion. It's wonderful.
Oh, thank you, Elizabeth.
Okay.
Pleasure.